Hello, this is Kelly and Amanda, and we're going to tell you all about bariatric surgery. We will go through what it is, what types of people get these procedures done, and the different types of surgeries. There are anatomical variations to each type of bariatric surgery that we'll discuss. To finish, we will be looking at some radiology images post-surgery to get a better look at those anatomical variations.
So as Kelly said, we are going to first be talking about what bariatric surgery is. Generally, it is a weight loss surgery that makes anatomical changes to the digestive system in order to make food absorption less efficient or your body unable to ingest as much. There are different types that we will be talking about later on in this presentation.
So, why is there bariatric surgery? For starters, it's important to explain the BMI scale, which is used to indicate healthy body weight. It is a ratio of weight to height, and as shown on this figure, below 18.5 is considered underweight, between 18.5 and 24.9 is considered normal weight, and above 25 is considered overweight, and then above 30 is considered obese, with increasing severity the higher the BMI after 30.
I would also like to point out that BMI is not always the best scale to use, but we are explaining it because it is used in bariatric surgery criteria. Okay, now that BMI is understood, it is important to point out that 61% of Americans are considered either overweight or obese on the BMI scale. With such high rates of a condition that can have detrimental health outcomes, medicine is needed to come up with intervention to combat the growing rates. Bariatric surgery has been shown to help individuals lose up to 75% of excess weight and keep it off with a 70% success rate after 5 years post-surgery.
As was mentioned, the BMI scale is used as a criteria for determining whether or not an individual should get bariatric surgery. Based on research on the risk at certain BMI, it was determined that if an individual was either above 40 or above 35 with another obesity-related condition, they are eligible for bariatric surgery. This criteria also keeps in mind how many times the patient has tried to lose weight with diet and exercise. These surgeries are suggested after the patient has had 6 serious attempts. The obesity-related conditions may include heart disease, high blood pressure, type 2 diabetes, some cancers, obstructive sleep apnea, and high cholesterol. The learning objectives of our presentation are to understand the anatomical variations among each type of bariatric surgery and how to interpret the radiology of someone who has received bariatric surgery.
Now that we have discussed who gets bariatric surgery and why, we will be discussing the specifics of each type of surgery. The 4 main types of bariatric surgeries that we will be discussing are gastric bypass, gastric banding, gastric sleeve, and intragastric balloon. The first one we'll be talking about is gastric bypass. In this surgery, the top part of the stomach, otherwise known as the cardiac region, is cut as shown in this drawing. This decrease in stomach size decreases the amount that the patient will be able to consume post-operation. The next part of the surgery is attaching the top part of the stomach that is still attached to the esophagus to the jejunum. As we learned earlier in this course, normal anatomy of the GI tract includes the esophagus leading to the stomach and then to the first part of the small intestine, which is the duodenum. The duodenum is where a lot of the food is absorbed. So when the gastric bypass surgery is done, the stomach is anatomically smaller, reducing food consumption, and the duodenum is bypassed, which decreases calorie absorption to help the patient lose weight.
The next bariatric surgery that we will discuss is the gastric banding. In this procedure, there are 1 to 5 incisions made in the abdomen, and then the laparoscope is inserted. The adjustable band is placed around the top portion of the stomach. The band creates an anatomical variation in the stomach that makes it smaller than a usual stomach. This decrease in stomach size results in the patient getting full more quickly, which can also lead to weight loss.
So, along with the weight loss, gastric banding has also been shown to treat type 2 diabetes post-operation. So really quickly, this study looked at the results of gastric banding surgery on patients with type 2 diabetes. This figure compared both weight loss and type 2 diabetes remission between a surgical group and a conventional group. It was found that the surgical group lost more weight and had a higher prevalence of type 2 diabetes remission. It is pretty cool that anatomical changes can help improve our physiology.
The third bariatric surgery that we'll tell you all about is the gastric sleeve. This is actually the most common bariatric surgery performed in the US today. It involves small incisions made on the abdomen for the trocars or the surgical instruments used in this procedure to be inserted into the body. With these instruments, they are able to remove 75% of the stomach, leaving a tube-like structure shown in the image on the right. The small sleeve of a stomach causes the body to feel both more full and hold less food, which in combination helps the patient lose weight.
The final surgery we'll be explaining is the intragastric balloon. This is a newer form of bariatric surgery which involves placing a saline-filled silicone balloon into the stomach. The balloon is inserted by placing a catheter containing the balloon into the throat. An endoscope is also placed down the throat so the surgeon can see the inside of the stomach. The surgeon then fills the balloon with saline. The surgery allows the patient to lose weight by limiting how much they can eat, making the patient feel fuller faster. The balloon is not a permanent fix. It is removed after about 6 months.
So we're going to show you some radiology imaging, and that is used to assess the anatomical variances that have been created by the surgeries post-op. This, as we know, allows for us to look at the inside of the body without opening anybody up again. So these first images show a transverse view on the right of someone who has had gastric bypass. The ES in that image stands for excluded stomach, so that's the part of the stomach that has been bypassed. The P is the gastric pouch, and the J is the jejunum. And you can see another different view on the left.
In this image, you can see the band that is used for the gastric banding procedure. The B is the silicone band, the T is the connecting tube, and the P is the reservoir port where saline is inserted to inflate the band.
This image shows someone who has had the gastric sleeve procedure. You can see that the arrows are pointing where about 75% of the stomach has been removed, leaving a thin tube known as the sleeve.
These last images that we will look at are the intragastric balloon. The image on the left shows an ultrasound of the intragastric balloon. On the right, you can see where the intragastric balloon is placed in the body. It is placed in the body of the stomach to reduce the amount of food that can be consumed. As you can see, each type of bariatric surgery is unique. Many factors go into the patient's decision of which type of surgery to choose, such as the invasiveness or permanency of the procedure. However, each type of bariatric surgery shares the same goal, which is to help the patient lose weight.
Thanks for watching. Here are our references and a summary of group participation.